Good morning. Today, I am pleased to report that we have no new cases of COVID-19 in the province. We have 3 active cases and 41 are considered recovered. All 44 of our cases have been linked to travel. PEI is in an enviable position of not having had any widespread community transmission of COVID-19 up to this point. As a general update, around the world there are almost 24 million cases of COVID-19 and over 800,000 deaths. And United States, Brazil, and India now accounting for over 50% of the cases globally. In Canada, there are almost 126,000 cases and a case fatality rate of 7.2%. We did see a small increase in cases in Canada over the last week, with the greatest increases being in British Columbia, Saskatchewan, and Manitoba. And there was also a 27% increase in deaths compared to the previous week. In the last week, 64% of our domestic Canadian cases are in the under 40 age group, with 25% of the new cases being in the 20 to 29 age group. And some general updates in terms of our COVID-19 inspections and enforcement. 1,563 COVID inspections have been completed, with 80% considered satisfactory on first inspection. And most of the unsatisfactory inspections relate to not having or following an operational plan or not having or following an exclusion policy. To date, there have also been 465 compliance checks, 151 warnings, and 39 charges related to individuals not respecting the requirement to self-isolate for 14 days. A total of 25,200 COVID-19 tests have been completed in PEI, including 1,714 in the past week. And in terms of COVID testing per capita, PEI still ranks second in Canada, having conducted 163 tests per 1,000 population, compared to an average of 136 cases per 1,000 population in Canada. COVID-19 has been especially challenging for our seniors in long-term care and their families. In the early days of the pandemic, there were many weeks when families were unable to visit with their loved ones in care. We started with outdoor visits and gradually increased visitation, including a designated partner in care. PEI has moved cautiously to increase visitation and socialization for our loved ones in long-term care facilities, always aiming to reduce and minimize the risk of COVID-19. We are working with Health PEI and operators of private and public long-term care facilities to further ease restrictions in a number of areas, including residents will have no limit on the number of visitors. Residents can have up to 3 partners in care. Residents can go for drives with their partner in care and exit the vehicle, provided it is in a controlled environment and avoiding public crowded areas. Residents will be able to go on overnight visits with their partner in care following infection control procedures. And family members can visit between long-term care facilities, provided infection control measures are maintained. And the number of visitors and duration of visits for all areas will be removed, including end of life. I anticipate that these new measures will come into effect on September 1st, appreciating that facilities will implement these changes based on their own capacity. It is up to the individual facilities to determine how best to move towards increased visitation and socialization for residents in their facilities. We continue to get questions about masks, and our provincial guidance on masks is similar to what is recommended by the Public Health Agency of Canada. It is strongly recommended that non-medical masks be worn when it is not possible to consistently maintain a 2-meter physical distance from others in closed indoor spaces. Masks and face coverings provide another level of protection against COVID-19. They are not a replacement for other public health measures. Ensuring that you are following good hand hygiene practices, physical distancing, and other infection prevention and control measures are critically important. It is worth noting that more islanders are wearing masks when in closed public indoor spaces when physical distancing is not always achievable. And it is strongly recommended that masks be worn in grocery stores, other retail stores, on public transit, and other closed indoor spaces such as hotel lobbies and banks. Now is the time when islanders should get used to wearing a face mask or covering in indoor spaces. And with school opening in 2 weeks, now is also the time when parents and guardians should be helping their children to learn how to properly put on and take off a face mask. Children need our help to understand the importance as well of good hand hygiene, physical distancing, and wearing a mask. The World Health Organization and UNICEF recommend that children aged 12 and older should wear a mask under the same conditions as adults when it is not possible to maintain physical distancing and when there is widespread community transmission. And similar to this international advice, the PEI Back to School plan recommends masks be worn by students in grades 7 to 12 inside school facilities when physical distancing is not possible. In addition, masks are strongly recommended while traveling on the bus for students of all ages and the bus driver. We continue to monitor this issue, and if we need to, we will consider making the use of masks mandatory. Our ability to respond effectively to COVID-19 and quickly contain outbreaks and clusters is directly related to our ability to offer accessible testing, early detection and isolation of cases, and timely contact tracing. And they have, we've mentioned before, are foundational to contain the spread and the impact of COVID-19. Work is underway to further expand access to testing for individuals with symptoms of COVID-19. Health PI, and Marion may speak to this as well, is working on providing a drop-in or drive-through option to expedite testing for individuals with symptoms of COVID-19. And going forward, I would like to see that if a parent gets called to pick up their child at school or daycare because he or she has developed a symptom of COVID-19 or a new cough, for instance, they should be able to go directly to a testing clinic and be swabbed. And then they would then wait for the results to come back. And we are working also on an online option for islanders to access their own negative test results. These efforts to increase access to testing, including the testing sites and the negative test results, are being finalized, and I anticipate they will be ready in the week ahead. I'd like to extend a special thanks to the staff of IT Shared Services for their ongoing support of our provincial COVID-19 response efforts. We've received high-quality, timely support from this group of professional staff, and we've often requested their assistance on weekends and evenings, and they've always responded, so thank you. As well to Health PEI and Marion and her team and the lab as we work to increase access to testing. I appreciate that islanders are growing tired of the many COVID-19 restrictions and the way this pandemic has impacted our lives. And I share that fatigue. But while we know we must learn to continue to live with COVID-19 until there is a vaccine, we all appreciate that this is challenging to accept this reality. But I think we are all coming to the realization that with COVID-19, we are in this for the long haul. The prediction of a second wave this fall that will be stronger than the first wave is worrisome. While we cannot be certain how COVID-19 will move, we have to be mindful of the national modeling and projections for a second wave. We are often reminded that there's never been a pandemic that did not have at least 2 waves. On a positive note, we have much for which to be thankful. We've not had any hospitalizations or deaths related to COVID-19 at this point. We've not had any outbreaks in long-term care or community care facilities affecting many residents or staff. We've not had any clusters or outbreaks in any of our food processing plants or other workplaces. I want to thank all Islanders for following public health measures and taking the necessary steps to protect yourselves and others from COVID-19. As a province, we are demonstrating that the only way to get through this pandemic is together. Last week, I outlined some of what the new normal on PEI will look like from a public health perspective. We discussed the possibility of having larger gatherings, increased testing and contact tracing capacity, easing of restrictions in long-term care, fewer restrictions on sporting activities, and increased seating capacity in restaurants. And as long as we have low prevalence with little or no community spread of COVID-19, we will move towards our new normal in early October. So as we enjoy these last few weeks of summer and help our children get ready for another school year, please remember to stick to the basics of physical distancing, wearing a mask when enclosed indoor spaces, keep your circle of contacts small, and practice good hand hygiene. These measures will be effective in minimizing the spread of COVID-19 in our community. And as we continue to adapt and adjust to living with COVID-19 now and in the longer term, and as we all deal with an element of COVID fatigue, I encourage all Islanders to be grateful. Grateful for our family and friends, grateful to be living in this beautiful province. And maybe it's also a good time to take a step back and think about those things for which we have to be thankful, and they may be simple things, and time even with our families and our families and children. So thank you for continuing to follow public health measures, and we can show each other we care by following these public health measures. With yourselves and your loved ones and with others, please be patient, please be kind. Thank you. Turn it over to you.
Good morning, everyone. As Dr. Morrison mentioned, testing continues to be a critical part of our COVID-19 response. And this week, we established a new additional unscheduled drive-through COVID-19 testing clinic in Charlottetown at the Eastlink Center in the parking lot. I want to thank Island EMS for their partnership with us and their ongoing work in supporting our testing sites. The unscheduled drive-through clinic has started with routine testing of essential workers and any symptomatic children or family members. This clinic will run Monday to Friday from 8 to 5, as does our Borden clinic. People are being notified of this new access to testing when they call for an appointment. Other requests at this point in time for testing continue to be scheduled through our regular clinic. Yesterday, this service started and 60 tests were collected at that site. In total yesterday, 240 swabs were taken at our Charlottetown, Summerside, and Borden clinics. As testing needs will continue to change over the weeks and months ahead, we do expect there to be more adjustments to ensure we continue to offer the best possible access to COVID-19 testing and be prepared to manage outbreaks or increased testing needs as they come forward. I want to give a little update on our progress with respect to the easing of long-term care restrictions and other visitor restrictions, which we've again reviewed from a health PEI perspective. We're happy to see additional partners in care being able to participate in the lives of their loved ones within our long-term care homes, and the increase in visitation that will be safely permitted to be increased across all of our services. We'll be prepared to adjust our services to meet those changes come next week, as Dr. Morrison mentioned. Thank you once again to the staff and physicians within Health PEI who are working so hard to prepare for the coming waves of this pandemic, while also continuing to provide high-quality care to Islanders. Again, to our patients, please remember our services are safe, attend your appointments, get health care if you need it, and remember to bring and wear a mask or face covering to help protect everyone. Thank you.
Thank you, Marion, and we'll open it up for questions.
Carrie Campbell, CBC. Oh, hey, thank you. Just further to that new drive-through testing clinic, I just wonder what's the plan with that? You said essential workers were there yesterday. Is the idea that that would expand beyond essential workers? Is this going to be an option for regular Islanders who need to go in for a test?
Yes, that would, Marion may want to add to that, Carrie, but that would be the intention. And I think as we go into the fall, and certainly we've heard from the public concerns of having to wait to get appointments, and when we're knowing that school will be in session as well, we need to be able to have good access to testing. And certainly my perspective, and I know it's shared by Health PI, that would expand to have access to, for anyone who has symptoms that needs to be tested, should be able to have easier access to it.
Yeah, I can just add that I would agree with what Dr. Morrison has said, Carrie, and we really started it yesterday with those essential workers and any of their family members, trying to get these new clinics up and running and manage the volume, and also make sure our processes are clear. We're looking at the other components as well that have been mentioned this morning around information technology support that will help streamline our workflows. So I would reiterate Dr. Morrison's thanks to our ITSS staff who have really helped us in setting up these additional services all along. Because we will need additional support to help us increase our volumes and access, and some of those things will really support. So starting out with the essential workers and their family members, and making sure we've got the kinks worked out and the process flowing smoothly so we can further increase the access. And of course, you know, our Charlottetown site is getting prepared to move in the coming weeks, so that's also been factored in on making sure we're prepared at the new site to manage this type of testing as well.
Okay, thanks for that. Another question, probably for Dr. Morrison. We're hearing again from Nova Scotia that they're maybe musing about opening up to the rest of Canada. So I just wonder what your position is, because we keep hearing about this. If Nova Scotia allows the rest of the country in without requiring them to self-isolate, what is your level of comfort with us bubbling with Nova Scotia? And also I just wonder, what is your current position on whether PEI is in any position to talk about lifting its restrictions?
Hi, Carrie. So, I think we've talked about it, as you mentioned, different times. And at this point, my position would be that I would be more comfortable making sure that we have our international students arrive, as well as make sure people get back to school before any consideration of the Canadian bubble. If Nova Scotia does open up to the rest of the country, we continue to have screening at our points of entry, and that would include the question of if they have been outside the Atlantic, Canada, and also have they been in close contact with anyone who had been outside Atlantic, Canada in the 14 days prior. So that is, I think, how we would address it. But all the way along, this is a discussion that has been at the Premier level, and I imagine those discussions will be continuing this week.
Thank you.
Welcome.
Stu Neatby, Guardian.
Hi, good afternoon to you both. I suppose a first question to Dr. Morrison. There's was a bit of a discussion in one of the standing committees about the whole question of mandatory vaccinations for children in schools. I think in the past it had sort of been I understand, a bit of a policy that wasn't something that PEI was doing, but with the possible onset of influenza coming up this fall, is this something that the CPHO is kind of revisiting or looking into at this point?
Hi, Stu. The question of mandatory vaccinations certainly has come up different times over the years. We're in a very fortunate position here in PEI that we have very high rates of childhood immunization. We look at measles, which is one of the ones, one of the most communicable vaccine preventable diseases, and we have a rate of 95.3% by school entry of measles containing vaccine. And right across the board, we have very good vaccine rates. So I have been asked to go back to the standing committee and talk about mandatory vaccinations, which I look forward to doing, I believe, next week. And there's nowhere in the country that influenza vaccine is mandatory for children, and but there are two provinces that do have certain, or a couple provinces that have certain vaccines that are mandatory before school age entry, but they are not influenza. But I think it's always a good discussion to have about the importance of vaccines, why we need them, and similar to masks, if it's something that we think we need to make mandatory, absolutely we would. But we've had very good childhood immunization rates up until this time.
Okay. I guess just as a follow-up, I am. There have been a couple of kind of calls for more increased regime of testing as we sort of head into the fall school season. So, I guess I'm wondering if there's any kind of target for increasing the rate of testing, particularly for education staff or students, as the fall kind of progresses into September or October.
So, Stu, I guess a couple of comments. One, we have been working with the lab, and it is always our anticipation for our capacity to do increased testing going in the fall. We anticipate really doubling our capacity for tests in this province as we go forward. So I think that is a really positive thing. The other is making sure that we have really good access, both on making sure that people can quickly get in to get tests, and as well as get their results back more quickly online. We have, continued to look at when should you test, when should you not test. Certainly the best time to do test is when people are symptomatic. We are doing some asymptomatic testing for certain high-risk groups, but at this point in time, we anticipate we will be doing a significant number of tests with children and teachers and staff if they have any symptoms at all, and because they won't, they'll be sent home if they have symptoms. So we will be doing a considerable amount of testing of students and staff. I anticipate going into the fall, because it's also going to be respiratory season and there'll be other viruses around, and it'll be hard to tell if it's COVID or not. So we will be doing a lot of testing, but certainly the recommendation is not to do widespread asymptomatic testing on top of that at this point in time.
Okay, thank you very much.
François Leblanc, Radio-Canada.
Oui, bonjour. Deux questions. Premièrement, ce serait sur... vous avez dit que, je pense que la semaine dernière, vous avez dit que vous étiez pour avoir comme une cinquantaine de personnes aux événements sportifs. Là. Est-ce que vous pouvez juste me préciser comment ça va se passer exactement pour les gens qui vont rentrer dans les arénas, dans les stades, etc. Et avec ça, est-ce que ça veut dire que vous pourriez permettre au tournoi de la Première Ligue canadienne de soccer là, qui se déroule à Charlottetown présentement, est-ce que vous pourriez leur permettre d'avoir des spectateurs, mettons, pour les séries éliminatoires ou quelque chose comme ça?
Alors bonjour. Alors je vais répondre aux deuxième question. Je sais que le tournoi de foot qui est en prend place maintenant ici à l'île Prince-Édouard. On n'a pas de spectateurs à ce moment, mais ils vont, je pense, essayer de mettre un plan à notre bureau pour voir si on peut avoir les spectateurs qui entrent dans un entrance qui séparés, puis ils ne vont pas être ensemble avec les joueurs, mais on va regarder le plan pour voir si on peut le faire. Et ce sera une chance pour les jeunes joueurs de foot pour regarder ces matchs. Alors, c'est possible, mais à ce moment, il n'y a pas une décision. Et pour les autres éléments sportifs, c'est vraiment avoir les groupes de 50. On peut avoir un maximum de 3 groupes de 50 qui encore ne font pas... on ne veut pas qu'ils se mêlent entre les 3 groupes, mais qu'ils soient séparés. Et c'est pas seulement pour les éléments sportifs, mais les autres groupes, grands groupes d'activités. Alors, je ne sais pas s'il y a d'autres choses en particulier, mais si on a 3 groupes, il faut... on regarde les salles de bain et où il peut entrer ou sort pour qu'ils ne mêlent pas ensemble.
Merci. L'autre question que je voulais poser, c'est sur le sport scolaire. On va voir la rentrée scolaire bientôt. Est-ce qu'il y a des choses qui se développent de ce côté-là? Est-ce qu'on va permettre la pratique de sport scolaire entre des écoles de l'île, des placements, etc.?
Oui, je pense que le plan est que pour les premières semaines, ils ne vont pas faire grand-chose, mais je pense qu'on va avoir la chance entre les insulaires, les écoles ici, on peut avoir les jeux ensemble, les jeux sportifs. Avec des modifications, des fois, et ça dépend sur le sport.
Merci.
Nicole Williams, CBC.
Hi there. So sorry. Before I get to my questions, Dr. Morrison, I'm wondering if you could translate the French answers for me, please.
Okay, I'll try to remember. So I think one of the questions was around the soccer tournament, the Canadian League that is here presently playing, wanting to know if there are any chance of spectators going. And so my response was, at this point, there aren't any spectators at any of those games. They may be submitting a plan to see if you can have a group of 50 spectators, particularly young soccer players who may get a chance to be able to watch that kind of high-level soccer. But that plan will have to be approved by our office, just like other plans. And we'd have to look at making sure that there's no mixing between those people, the spectators, and the players, of course, and how the entrance and exits would work. So that is, there's nothing been approved yet, but that is a possibility if they submit the plan. And I think it was also a clarification from last week about the groups of 50 at a sporting event. Of course, even within the group 50, that maintaining physical distancing really important. But it is 3 groups of 50 can participate, for instance, at a larger event, and they have to not have any mixing in between those groups. I think those were a couple of the questions, and the other one. Oh yes, school sports. Sorry, thank you. The other one was school sports, and I think we've spoken about that, and education has spoken to that. That they don't anticipate school sports to be starting this week back to school, there may be a pause on those, but as we go forward and we look ahead even to October, where if things are going well, we may be able to reduce the modifications that we have asked for in terms of sport, and there'll be chances to play between schools, and we hope that that is able to happen. And it may depend on the sport and what modifications, of course, are put in place, what that looks like, but we're hopeful that our children in schools can participate and have as much back to normal as possible, given the fact that we're still in a state of public health emergency, we're still in the middle of a global pandemic, but doing our best to, go back to a new normal.
Perfect. So for my actual first question, I just want to clarify that this new drop-in testing site at the Eastling Center for Essential Workers, will this be the same site the public will eventually be able to use, like if they do need to pick up a kid from school with COVID symptoms? And how far away are we from the public being able to use this site?
Hi. So I think we're definitely hopeful that the public will be able to use it in early September, because we want to have it in place before school starts, and I think that is a need for the province. And I'll let Marion speak to the site of the testing clinic. And I think the other thing we're exploring is, and I think it's important to address, is what about access to testing on our sort of up west and eastern Prince Edward Island, and what can we do to make sure that people have good access to testing in other parts of the island? That has not been, finalized, but I think these are the ongoing discussions that are important to have as we go through it. I mentioned we're in this for the long haul, and as we get ready for a potential second wave, we really need to have these discussions.
Yeah, I would just add, Nicole, that we would anticipate the public being able to access the same site that we currently have up and running until that site is moving. Because right now the one in Borden exists and is at a bit more of a temporary to permanent medium-term location, and we've made some modifications there from the initial Borden site. The one in Charlottetown is just new, is set up to start yesterday morning, and that site is in the Eastling parking lot, so that site will be moving in the coming weeks. But we do hope to have this available to anyone who has symptoms. We certainly have wanted from the very beginning to provide that access and encourage anyone with symptoms of COVID-19 to be tested. I think Dr. Morrison and her team and the lab have really worked diligently to search for any positive COVID-19 cases, and we have been so fortunate here to have mild to moderate illness only. So we want to be able to continue to have people have good access, looking at those other sites as we do continue on over the coming months to put some plans and resources in place. It's also why we've been reaching out for additional staff to help support these new services, because we have had to pull staff from other health services to offer this testing. So we're looking at all of those things, hoping to have it up and running and available for anyone who's symptomatic, so that people can have earlier access to the negative results online, as Dr. Morrison mentioned. All of those components have been moving forward as we've continued to work on our response.
Thank you. And I think my next question is for Dr. Morrison. I just wanted to ask, our case count has been low, if not, sometimes non-existent for a while now, which has been really positive. I'm wondering, I guess, why, I think some people might be wondering why it's taken so long to make these changes to long-term care homes happen. And I'm wondering why you're now making these changes. What have you been hearing from residents and their loved ones?
I mean, I think right from the beginning, we have said we want to be careful and cautious as we go forward. In this country, the majority of deaths and the majority of illness has occurred in long-term care facilities. And when you look at those numbers across the country, they are an area of particular vulnerability. So we have approached everything we've done, cautiously and stepwise, and I think it has, to this point, served us well. And we have done that with the long-term care facilities, starting, as we mentioned, outdoor visits, indoor visits, partners in care, and increasing that. And also the homes, both private and public, need to feel comfortable as well. We have certainly heard from residents and families that they want to make sure their families are safe, that the residents are safe, and that has been a priority. But of course, they're missing the connection, and so we're balancing that and have been for many weeks, and so I think this is really almost back to normal in terms of visitation, if you can call it that. And so I think we'll be watching carefully, because we may have to make changes if our epidemiology evolves as well.
Thank you.
François Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. J'aimerais que vous m'expliquiez en français comment ça va fonctionner les cliniques de tests, de dépistage avec le service au volant. Qu'est-ce que ces cliniques-là vont remplacer? Où est-ce qu'elles vont être situées? Et pourquoi le besoin d'avoir ces cliniques-là en ce moment?
Alors, bonjour. Les cliniques de tests, c'est vraiment pour qu'il y ait plus d'accès immédiat pour c'est pour les insulaires. On veut avoir les cliniques de tests pour s'il y a les enfants à l'école qui sont malades, ils deviennent malades. On veut qu'ils soient testés tout de suite et facilement. Alors, ces cliniques sont déjà là, mais c'est augmenter l'accès. Alors, ils ne vont pas remplacer les autres choses, mais on veut pas que les parents attendent 2 jours pour qu'ils vont aux cliniques pour avoir un test. On veut qu'il y ait du bon accès, parce que si on a des tests, on veut qu'on tout de suite faire les contacts, cherche les contacts et informe l'école. Alors, je pense que ça va être important pour les personnes qui travaillent, mais aussi pour les enfants et les écoles.
Avec les cliniques mobiles que vous avez, comme celle de Borden-Carleton ou celle qui est dans le stationnement du centre Eastlink, que c'est à Charlottetown, est-ce qu'il y a une possibilité d'en ajouter des cliniques mobiles comme ça pour servir, par exemple, les résidents de la région du comté de Kings ou de la région de West Prince?
C'est exactement ça qu'on est en train de discuter, parce que s'il y en a beaucoup de personnes, les étudiants dans les régions Est et Ouest de l'île du Prince-Édouard, on veut qu'ils aient l'accès. Alors, on est en train de discuter qu'est-ce que ça veut dire en propos de l'accès, mais on n'a pas une décision à ce moment. Mais c'est possible. Thank you very much.